Okay, let's discuss the 5 transporting points. Ying-Spring points, SI2, the front body. Location on the ulnar aspect of the little finger distal to the metacarpophalangeal joint at the junction of the shaft and the base of the proximal phalanx. How to find an ulnar aspect of the little finger, palpate along the border of the red and white skin in the direction of the metacarpophalangeal joint until you can clearly feel the junction between the shaft and the base. SI2 is located at the junction of the shaft and the base and slightly inferior palmar to the exterior curvature of the bone. LI2 is located in a comparable position on the proximal phalanx of the index finger. In a comparable location on the foot are bladder 66 on the lateral aspect and spleen 2 on the medial aspect. Needling 0.2 to 0.5 tune obliquely in a proximal or distal direction and slightly towards the palm. Caution, painful point. Action indication, it drains heat, expels wind, disperses accumulations. Special features, it is a Ying-Spring point, water point. Like all spring points, SI2 clears heat, both interior and exterior, can therefore be used to expel exterior wind heat, especially if it affects neck and eyes, and also to clear interior heat from the small intestine channel, but mostly in acute febrile disease. Owing to its relationship with the bladder within the greater yang, it can also be used to clear bladder heat when this causes burning and urination. It expels wind heat in mumps, version to cold, fever, febrile disease, cough. It also benefits the eyes, nose, and ears in blurred vision, high pain, red eyes, nasal congestion, nosebleed, tinnitus. It removes obstruction from the channel in stiff neck and upper back, pain in the scapula, pain in the arm, pain in the wrist, pain in the little finger. According to the classic of difficulties, Ying-Spring points are indicated for heat in the body, and as the Ying-Spring and water point of the small intestine fire channel, SI2 has a especially strong action on subduing fire. SI2 belongs to Taiyang channel, the most exterior of the 6 channel and able to clear heat, especially exterior wind heat from the superficial portion of the body, particularly in the eyes, nose, and ears. It's indicated for bursting eye pain, redness of the eyes, congested nose, nosebleed, and tinnitus. It is also able to clear exterior heat from the lungs and throat, cough, throat painful obstruction, fever, thirst, and to treat malaria. When heat pathogen is virulent, it may give rise to toxic heat characterized by inflammation, pain, and swelling. SI2 is indicated for mumps, swelling of the cheek radiating to the ears, and swelling and pain of the neck and throat. Finally, SI2 is indicated for stiffness and pain along the small intestine channel from the hand up to the neck, as well as for numbness and heat of the fingers and palms. Combination swelling of the throat with inability to swallow. SI2, kidney 6, liver 4, 1000 Ducat formulas. Tired throat, swelling of the neck with inability to turn the head, swelling of the cheek that radiates to the ear. SI2, GB12, Sanjiao 16. Deafness, SI2, SI3, LI6, supplementing light. Tinnitus, SI2, LI6, LI5, LI1, bladder 8, SI4, supplementing light. Eye pain, SI2, LI5, LI2, PC7, LI3, DO23, rate compendium. Superficial visual obstruction, SI2, and bladder 64, 1000 Ducat formulas. Malaria with chills and fever, SI2, lung 7, SI3, SI1, 1000 Ducat formulas.